Here's everything you need to know about TTP for step 1. First of all, the way to remember it, connect this T in atom, and normally atom TS13 snips down the ultra-large von Willebrand factor so that platelets don't stick like crazy. And because this thing is not around, atom TS isn't around, platelets are going to vanish. The red cells are just going to smash into clots, and they're going to fragment into what's called schistiocytes. And that'll make the creatinine climb, and the brain will then misfire, and you get a fever. And that's why we have the terrible pentad. So in these people, you have severe thrombocytopenia. They also have microangiopathic hemolytic anemia because of that shearing, but they have normal PT and PTT. And you treat them by starting plasma. So you pull out the antibody and you supply fresh atom TS13, and your mortality plummets from 90% to 10% or less. So if you see schistiocytes and low platelets, definitely think of TTP. Here's our practice question. Fragmented RBCs. What explains the disorder? Autoantibody-mediated inhibition. So this is an acquired IgG inhibitor that knocks out your atom TS13. So then the super big von Willebrand multimers persist and trigger platelet-rich microthrombi. That causes thrombocytopenia, microangiopathic hemolytic anemia, and renal and neural signs with normal coagulation tests. It's not HIT, that would be thrombocytopenia after heparin, but the coag times are normal and there's no MAHA there. Endotoxin-induced tissue factor release would be DIC. That consumes your clotting factor, so you'd have elevated PT and PTT, low fibrinogen, and increased D-dimer. Fibrinogen is that soluble protein that's present in the blood plasma from which fibrin is produced. Bone marrow infiltration, you'd have anemia, thrombocytopenia, and the smear shows blasts, not schistiocytes. Blasts look kind of like that. They're like more full looking and pretty big too. Also, why is it not inherited deficiency of G6-phosphate dehydrogenase? Because that causes hemolytic anemia, especially if you have stress, medication, certain foods. Sometimes you can have low haptoglobin as well. But for those guys, you don't see thrombocytopenia. Also, you wouldn't see the schistiocytes necessarily. You'd see the Heinz bodies. So there you go. If you found this helpful, like and subscribe.